بحضراتكم في الحلقة الرابعة والأخيرة من VPL Made Easy. مع حضراتكم محمود الليثي، مدير وحدة التعلم الإلكتروني في كلية الطب البشري جامعة الزقازيق. هعرض لحضراتكم فيديو كمثال عن استخدام ال VPL سيناريو في ال Problem Based Learning Tutorial. ازاي حضرتك كمحاضر تحقق الاستخدام الأمثل من ال VPL سيناريو مع الطلب.
Well, good afternoon, and today we are going to meet John Foster. It's our second problem in the cardiovascular system. As you remember, the previous one was about the patient who have difficulty in breathing, and it was something related to heart failure. So let's meet Mr. John Foster now.
Okay, guys, last week Mark was the leader for our session, so today I will take over. And Padma, can you please be the scribe for today?
Yeah, sure.
Thank you. We can start now. 6 a.m. in the emergency room, a 56-year-old patient is admitted complaining of severe chest pain. Let's talk to the patient now. So can we read the question one by one, starting from Asim maybe?
You think it's more appropriate, one or two of them? No need to read all the question each time.
Okay, so I think we can choose either one or three. One, we will introduce ourselves, and three, we'll immediately ask him to tell us about his problem.
Yeah, you can read the question which you have selected.
Okay, question one is, good morning, Mr. Foster. I am the emergency doctor, and I will be looking after you today. The third question is, tell me about your chest pain.
I think we should go with question number one because it's more formal and it's more decent to inform the patient who's looking after him, rather than question number three, which is just tell me about it. It's quite vague, so we should choose question number one.
Yes, I feel question number one is the most appropriate because you should introduce yourself and you should tell him that you'll be caring of him today.
Okay.
I agree.
Right. So let's choose number one then, if everyone agrees.
Thank you, Doctor.
What do you think should be the next question? The most appropriate one?
I think we should ask him about the main problem, which is his chest pain, and describe it. Which is the question number one, which says, tell me about your chest pain.
What do you think of question number 5? Can you describe what the pain feels like?
Question number 5 is like more of you're telling him to tell me the character of the pain, but you still don't know more about his chest pain. So you should provide an open-ended question so he can tell you more about the chest pain.
So everybody agrees then to choose the first question?
It's severe, and I've been having difficulty breathing.
I think we should ask question number 1, which is, when did the pain start now?
Okay. Do you all agree with that?
Yes.
The onset of the pain?
Yes.
Sure.
It woke me from sleep early this morning around 4:30. I also woke up feeling sweaty and having difficulty breathing.
Okay, what associated symptoms like did we get now from his answer? Sweat.
Severe pain.
Yeah, it was very severe. He woke up in the night.
Padma, are you taking a note of this? Yeah.
Yeah, I'm taking a note of this.
Okay, so what would be the next question then to ask?
Well, maybe before moving to the next question, even with this limited information received from the patient, can you think of some very early probabilities or what this patient problems could be, even before still proceeding?
I think orthopnea, because it's waking him up from sleep.
Orthopnea, okay. Is orthopnea a disease or it's a symptom?
It's a symptom.
It's a symptom.
Which means what?
They have difficulties breathing in the night. They can't breathe when they're laying down. Like they have to stand up.
Good, good. Why, Mark, you think it's myocardial infarction?
If you look at his presentation, it shows very classical symptoms you'd associate with the myocardial infarction. The patient is coming to the hospital immediate with acute chest pain, no other associated, he's showing other associated symptoms as well. So we'd like to assume that it's a myocardial infarction.
Shall we think of other like differential diagnosis possible?
It could also be acute heart failure.
I think it could be any kind of coronary artery disease.
Okay, let's see.
You want to
what's
ask him
next.
now, continuing taking and asking questions?
Yes. So what is the next most appropriate question that we can ask?
I think the radiation. So question number 4, does the pain move anywhere else?
I think it should be question number 3, that how can he describe the pain? Which says, can you describe what the pain feels like, so we can know the characteristics of the pain he's feeling?
I would like to disagree. I think question number 2 seems like much more appropriate choice, because here we are ruling out if the patient is suffering from any kind of gastrointestinal symptoms, or is it anything related to his heart.
Also, because question 2 would give the patient a clear image of what he's supposed to answer, because when you ask, can you describe what the pain feels like, we might not get the answer we're looking for.
But then question number 3, I think, is more open. So we're giving them like broader choices. Question express himself. Question 2 is more specific, limiting only to the options that we are giving
He
him.
would be limited to choose a decision based on the options we give him. He wouldn't have freedom to express himself as much as he would with question.
Because maybe I say number 3 because, as Mark said, number 2 you're limiting him. Maybe his pain isn't one of those types. So I guess we should go with number 3.
Of course, you can select from the same number of questions. You can select one question, see how the patient reaction to that, and then come back again and look into some of the other questions. It's like in real life. That's what we do. Okay, continue.
I don't know. It's severe.
Yes, I think now we can be more specific with the question.
Yes, it's a heaviness. It's like an elephant standing on my chest.
So shall we ask about the radiation now?
Yeah.
So we should choose question number 2 because we assume that the patient doesn't know what radiate means. So we keep in layman's terms so we understand. So question number 2.
Yes, it moves to my neck and moves to my left arm. Doctor, I'm scared. Am I having a heart attack like my father?
So we have to note here the family history. And also he said the the site of radiation.
Can you explain if the origin is the heart, why it will go to the right shoulder or to the left shoulder, and why it will go to the neck?
So because heart is on the left side of the chest, and I think it goes along the cervical nerves on the left side. What do you guys think?
Is it because it's compressing any of the nerves? For example, any of the phrenic nerves or any of the vagal nerves?
Maybe you should, if you don't have an explanation, what do you think?
I'm not sure, Professor.
Good. So when we are not sure what we are going to do,
We
Put
make
it
it a
on the
learning
learning
objective.
objective.
we put it as a learning objectives. Yes, if you all agree it's important. Yeah. Okay.
So we already got 2 objectives. We can move now further. What do you think would be the next question to ask the patient?
He just asked us if he's going to be okay, so we should address that problem.
We should reassure.
Yeah.
Yeah, I think we should like relieve some stress he is having, and like choose option number 1, which says it's too early to tell Mr. Foster. Let me complete my examination first.
Okay,
I
let's
agree.
ask him and see what he answers.
Sure.
Well, no, actually, doctor. I had this pain a couple of times about 1 year ago, but it was only when I was moving or exercising a lot. I thought it was just heartburn, but I went to my family doctor and he did some tests and an ECG. He told me I probably have something called heart angina.
Okay, Padma, we can make a note of past medical history now that he's got. He was diagnosed with angina 1 year ago.
Sure, sure.
I think we should ask, do you have any chronic illnesses? Because it's, again, history.
You have what, sorry?
If he has any chronic illnesses.
Chronic illnesses, yeah. Which question you like to?
I'm the same question they chose, which is number 2, which is
Yes.
if they have any chronic illness.
I was told by my doctor I have high blood pressure and high blood sugar. And at my last checkup, they said I have high cholesterol. My doctor gave me medications and told me to diet and lose weight.
Okay.
So, do you think it's important to know, like, why does hypertension or high cholesterol can lead to any heart disease? Do we know? Shall we put it in our objective? Or can we discuss it now?
We can discuss it right now, I guess.
So any more questions?
I think since he said he's got these chronic conditions, now it makes sense to ask him what medications is he using to treat those.
Oh, there's so many, doctor. My wife wrote them down on this piece of paper.
The list of, can you read it?
Etanolol 50 mg, isosorbide dinitrate, aspirin, atorvastatin, statin, metmorphin, glycerol, trinitrate.
Shall we proceed to the examination now?
Yes.
Okay, doctor.
So we can see his temperature. Is it normal? What about the pulse rate? It's 98. Can we say it's tachycardia?
Yes, because the normal range is 60 to 90. So
And the average is
Yes,
75. So yeah, it's high. And even the blood pressure, which is 150 over 100.
Yeah.
And his BMI is even high. So he's
What-
obese.
Obese.
And his temperature is normal.
So I think we should choose now what other tests beside ECG we should make. So troponin is a biomarker.
Yeah, where it's elevated during moratorium.
So what
What
is
other?
what is troponin?
is I think a protein that present in the muscular cells.
You have identified the different objectives related to this, as this is the first tutorial session, and there are many objectives, I think, and you have distributed these objectives among yourselves, so each one of you know the tasks. We have to go through it, and we will meet again by the end of the week, and I hope you will be prepared so that we can learn from you about the objectives you have identified, and we'll know more about the anatomy of the vessels and the types of obstruction which happens in the arterial system, in the coronary systems, the medication, the explanation, the physiology, pathophysiology, and so on. So I am looking forward to meet you again. I enjoyed this session with you. And before we leave, could you just give me what you have really enjoyed, or what you think about interacting with Mr. John Forst, although he's not with us in the room, but we were able to interact with him. So any feedback?
I think VPLs are a great opportunity for to learn about the communication skills with the patient. So as we saw, we ended up by gaining the trust of the patient because we chose the right options and the right questions to ask. Or otherwise, if we chose like some direct questions or wrong or inappropriate questions, we may not gain his trust. So it's a really great opportunity to build our communication skills.
I think in general it's crucial for us as medical students and future doctors to be able to communicate with the patient, not only to be strong at our medical basic knowledge, but also to be able, as Asim said, to build this trust, to feel the patient, to see. Through these VPL sessions, we are actually able to see the emotions of the patient, his feelings, his reactions. So it's very important, and especially I think during these hard times of global pandemic, we are having this opportunity to actually interact with a virtual patient. It's great.
Basic science and the clinical science.
I also think that having this kind of interactions and this practice, it's even motivating us and even encouraging us more to go deeper into basic science, because now we can see the actual application, we see the actual practical side of it. not only the theoretical knowledge, but we can now actually apply.
Yeah, that's what I was going to say. It helps us to correlate what's going on in our lectures with actual clinical cases, and it's very helpful because we can apply this knowledge later on in our actual clinical practice.
And what I like mostly about the VPL is that during this COVID-19 pandemic, it didn't stop us from communicating with patients and practicing and knowing more about this field. But we're doing it virtually and with the appropriate technology for such a technique.
For me, VPL is actually a session where I cultivate my thought process. I actually learn how to talk with a patient, and usually when I discuss with my teammates on which questions to choose and which questions to not choose, I understand different point of views, and I can learn new things from my teammates, so it actually encourages group learning. Also, as a doctor or as a medical student, talking to a patient and interacting with a patient is something that we all have dreamt of, we all love to do. And VPL gives me an opportunity to actually see the patient, understand the complex emotions that is involved when they come to us, and I can actually understand how much distress the patient is actually in when they come to us and when they see us, and when we talk to them, they feel so much at peace. So this is one of the best things I like about the VPL session, is that it prepares me to become a better doctor, and that's one of the things that I want to be and I want to learn. Thank you.
Thank you very much. I think this was a very good session. And as I've said before, we'll meet again by the end of the week. All the best.
Thank you,
Thank you, Professor.
Thank you, Professor.